So I'm a veterinarian and I'm an epidemiologist, and I've been working at WHO in public health for over 10 years, and primarily on zoonotic diseases, and much of my work has been focused on risk assessment. When I came to WHO in 2006, so one of the first things that we did was establish a routine mechanism for doing standard risk assessment for zoonotic influenza. And this was the time of H5N1, and there were a lot of cases in a lot of countries and a lot of questions. One of the things that we found with doing the risk assessment was, of course, we needed the animal health data. So we developed a way to collect and establish standard data from the animal health that we would use for our risk assessment, our public health risk assessment. What we weren't able to do was to actually establish a mechanism for routine assessment in collaboration with our animal health partners. That was something we tried several times with H5 as well as H7 influenza, and we were never able to get a process down where we would come to some agreement. And so now much of my work is focused on trying to develop standard processes and standard mechanisms for doing joint assessments. So working with our animal health partners in OIE and FAO to do risk assessments for emerging health threats or current health threats at the interface in a standardized way where we agree on the process, agree on the outcome at the headquarters level for global risks, but also developing tools and processes for countries to use, for ministers who want to work together, who have a shared health problem, so that they can have a standard process to come together and do an assessment together and come up with joint management options and joint communication options that they agree on. So really the key message is for public health to really find an appropriate solution and good management and good communications about a zoonotic event, we really have to work with the animal health sector because they have data and they have management and they have communication, and if we are aligned, we would do a better job of solving the problem.